Confusion also about coronavirus testing is widespread across this country. California, with a population of about 40 million, has 18 labs processing test kits. The state has tested just over 1,000 people and confirmed 159 cases. Our own Dr. David Agus is in Los Angeles. Good morning to you.
Morning, Michelle.
Well, Health and Human Services Secretary Alex Azar just told us there is no barrier for doctors to get tests that they need for patients. What's been your experience?
Well, let's be clear. He said there's no barrier for a public health official to have a patient tested. There certainly are barriers for doctors across the country to get patients tested, and I've seen it, and I'm getting calls, both from governors and from doctors across the country. Various states, it's easy. Other states, it's very hard. So there certainly is not ability to get tested on a same-day basis across the country at the present time.
Doctor, what impact has the delay in available testing had on how we contain and mitigate this virus?
A patient last night, they called me, the CEO called me of the company and said, they just tested my employee and it's going to be 5 days till I get a result back. How do you do a containment when it takes days to know the answer of what's going on? And so there was a piece in the New York Times yesterday about in Seattle, they started testing people, but the government said, your test isn't approved, you can't do it, even though there were positive tests. And it delayed actually quarantining people or keeping people contained, and it enabled some of the spread that happened in the city of Seattle.
David, what are you telling people about when they should get tested?
Well, right now I say if you have mild symptoms, stay home, self-quarantine. The system can't handle large numbers of tests, and I don't want people waiting in waiting rooms at ERs and at hospitals. So limit the testing now till the testing is readily and easily available.
So the administration says that millions of tests will be sent out by the end of this week. What happens when folks get them? I mean, who should be tested and how should they be distributed?
Well, realize what a test is. It's looking for 100 of the 30,000 letters in the virus, so 2 genes in the virus. And the government is sending out the template for those 100 letters. The problem is that all of the other reagents, which is actually to take the RNA out of the virus, the genetic material out of the virus, it was announced yesterday that reagent is short in the country. So even though the government's sending out tests, we're missing some of the reagents. And so what we need now are all the components of the test and people who can actually do the test out there so we can test the right people. The more we test, the more knowledge we have, the more we're going to be able to stop the spread of this virus. In South Korea, they're doing 10,000 tests a day, and they've been able to stop the rise of the virus. And the virus there started when it started here in the United States.
David, I want to get a quick question in on our frontline workers, healthcare workers who are now being told they can actually wear a different kind of face mask after the initial kind that was approved is apparently running short on supplies. What do you make of this expanded recommendation that a mask that wasn't okay is now okay?
We had a national stockpile of N95 masks, which are the better fitting masks that can actually filter most of the particles in the air. And what happened is we never replenished that after the last supply was dwindled down. And so we don't have enough in the country now. You see nurses unions today announced that they're protesting the fact that we don't have the right protective supply for the front line, which are the medical personnel out there. This is a big problem. We certainly need a national strategy to deal with these supply chain issues because they're happening over and over again, and we have to protect everybody.
Dr. David Agus, thanks, David.